Good afternoon. Welcome to day 250 at the EMA office, where we bring you the latest numbers on the COVID. Joined here with Chairman Mark Kern and Sam Bierman from the Health Department. Sam, got some numbers for us today.
Our numbers are a little better in the sense our percentage, our daily county positivity rate is down a little, but our numbers are still much higher than where we would like to see them. As of today, 137,964 St. Clair County residents have been tested, which is an increase of 1,282 from yesterday. We are at 12,245 positive test results, which is an increase of 160 from yesterday. And that does include both males and females from under the age of 1 up to their 80s. Today, our daily county positivity rate is 12.5%. And we have 125,719 negative test results. Unfortunately, we are announcing an additional death today, which does bring our total for St. Clair County to 239. That was a male in his 90s who had unknown health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 10,037. For state totals, 9,359,227 have been tested, with 606,771 positive test results, which is an increase of 8,922 from yesterday. And for deaths, the state is reporting 11,014, which is an increase of 140 from yesterday. For St. Clair County hospitalization numbers, currently we have 111 patients that are admitted due to COVID-related reasons, and 12 of them are on ventilators. And regionally, we have 243 patients that are admitted due to COVID-related reasons, and 23 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, we will only announce any facilities that have had changes. Caseyville Nursing and Rehab has 52 cases and 2 deaths. That is an increase of 1 case for that facility. Cedar Ridge of Lebanon has 89 cases and 16 deaths, and that is an increase of 1 case for that facility. The Shrine has 64 cases and 11 deaths, and that is an increase of 1 death for that facility. Integrity Healthcare of Belleville has 12 cases and no deaths, and that is an increase of 1 case. And finally, Mercy Rehab and Care Center in Swansea has 27 cases and no deaths, and that is an increase of 1 case. We do still have some testing available this week. Tomorrow, November 19th, we have the Clair Fairgrounds from 2 p.m. to 6 p.m. And then on Saturday, November 21st, from 8 a.m. to 4 p.m., we are at St. Clair of Assisi Church. And for specific information on those test sites, you can check the EMA Facebook page as well as St. Clair County Health Department page. And I will turn it over to Chairman Kern for his update.
Thanks, Sam. I think the most shocking number, if you look 1 month ago, we had 41 people hospitalized because of COVID. Today we have 111.
Mm-hmm. And that's just in our county alone.
Just in our county alone. That's and with 12 on ventilators. I mean, it's almost tripled since just 1 month ago. So for anyone who thinks we aren't in a crisis mode, we are.
We are, and as we've talked about, the increase of numbers we're seeing is from Halloween. And if this is the increase for Halloween, I am terrified for what our increases are going to be for Thanksgiving and for Christmas if we aren't very careful and, making wise decisions on where we're going to be and who we're going to be around. I think, it could be detrimental to us if we don't have some good decisions that are made.
And that's why we want people to take advantage of the testing.
Yes.
Barb Holtz worked very hard to set up these testing dates and work with Southern Illinois Healthcare Foundation to get these done. I think the state's part of all this too. So
they are.
Please come out and get tested. It's the only way we're going to be able to figure out who's got it, and only way we're going to be able to isolate the virus.
And our Thursday test that is from 2 to 6 is our first one that we are doing typically after normal business hours. So we hope some people that maybe weren't able to make it out to one that was during the day will be able to make it out to one that's after work.
Great, and plenty of room at the fairgrounds.
Yes, so plenty of room to social distance and keep your space.
We appreciate the fairgrounds certainly being a part of Team St. Clair. And speaking of Team St. Clair member Linda Whitaker is having a birthday today. So from all of us to you, happy birthday. We appreciate you being part of the team, and have the best birthday ever. We'll move into our zip code report. These are the changes, the COVID positive changes in these particular zip codes. 62203, we go up 1 today to 346. 62205 goes up 4 to 314. 62206 up 3 to 616. 62207 up 2 to 333. 62208 up 11 to 712. 62220 up 10 to 884. 62221 up 16 today to 1136. 62223 up 8 to 777. 62225 up 1 to 65. 62226 up 16 to 1293. 62232 up 5 to 346. 62240 up 1 to 63. 62243 up 4 to 238. 62254 up 8 to 401. 62257 up 2 to 86. 62258 is up 8 to 414. 62260 up 5 to 285. 62269 goes up 28 today to 1144. And 62285 is up 4 to 244. As Sam said, daily county positivity today is a little bit better, 12.5%. That's derived from 160 new positives and 1,282 tests. The 7-day rolling average then goes down today to 14%. So it's moving in the right direction, but man, those numbers are still way high. Regional positivity, and this is the state's number as they calculate it, goes down today a little bit to 16%. That's derived by Bond County being at 12.7%, Clinton County at 28.2%, Madison County at 21.9%, Monroe's at 23.7%, Randolph County 7.0%, St. Clair County is at 11.2% today, and Washington County is clocking in at 28.9%. Herb, the numbers are up, and the healthcare workers, I think, are really stressed out. I mean, the shifts that they're working are great. They have people that are, call in and are quarantined that they work with, and so it makes the shifts harder to fill. Our medical frontline workers are really ones that we need to be praying for and thinking about in these times, because they're really fighting this battle for us.
Well, and we say that all the time. The frontline workers are law enforcement, firefighters, the EMS personnel who are going out taking care of these patients. And it even goes beyond that. The nurses, the doctors, the health departments, Eastside Health District, St. Clair County Health Department, they're burning the candle at both ends. And we talk about that all the time. And just the general staff that is working these numbers every day to try to get this information out there. I think Dr. Ezike said it best today that, even with all of the hullabaloo that's been out there about is it real, isn't it not real, these numbers don't lie. I mean, in the region, 243 people in the region. And I want to say...
In the hospital because of COVID.
Because of COVID. And I want to say, our surrounding counties, I want to thank them, because you can see by the numbers, we monitor them every day. And some of them are putting out PSAs to their communities saying, hey, we've got to get these numbers down, because we have said 250 days now, we are all in this together. It's not just one county here, one county there. In this region, we're all together. What affects one affects all of us.
And we can see that the counties surrounding us are testing a lot more than they were.
Yes.
All that testing allows for us to figure out, or for the local health departments and the contact tracers to figure out who has it and be able to have those people stay home so they aren't spreading it, that they aren't out in the community with the general spread. But think about how discouraging it would be if you're a healthcare worker, a doctor, a nurse, a frontline worker, or all the people that you mentioned, and you go to the store or you go out or you see a local drinking establishment that's packed with people, or people not wearing masks when they're out in public. That would really be discouraging. When you leave work after a shift with 111 people, in your local hospitals, 243 in the region hospitals, and then you go out and see people who just seem to not care. And when you give so much and care so much, that has to hurt to see that people can't wear that mask, wash their hands, and watch social distance. So Team St. Clair, I know, gets it, and they're out pushing it, but I'm afraid there still are some people that don't, so we just have to try to get the message to them.
Well, and that's what I like to just leave us with today is just, as the chairman said, let's think about moving forward. The numbers went down a little bit today, the regional positivity rate, and I challenge everybody to let's try to take some of that negativity and say, hey, let's try for the next couple of days and see if we can't get it down a little bit more. And I think if we all just give it a little bit more effort, Team St. Clair, I know you got it in you. The chairman wished Mrs. Whitaker a happy birthday today. And there's other ones out there that every day follow this, and I know you're sharing it because we see that. But let's just do a little challenge here and challenge somebody to turn some of that negativity into positive. And let's just see if we can't make that work. If we can take this down a couple of more points each day, we'll be back down to where we need to be in no time at all. And as I said, what helps one in the region is going to help all of us. So again, we're in this together. We're going to be here. It's 250 days. You've been hearing this, and unfortunately, it's got worse. And now we got to get back down to where we need to be. We'll be back with Daisy in just a few moments to translate this into our Spanish communities, and we'll be back tomorrow for day 251 with some more numbers. Have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.